I want to welcome you all shortly before I mute you all to our service today. And today we'll be speaking with people from the charities that we support annually. And at this point, we can turn the meeting over to the leader of the service, Kathy. And you're muted, Kathy.
Welcome, everybody, to today's service of the Lakeshore Unitarian Universalist Fellowship. It's great to see all of you, and a special welcome to Jennifer, to Michael, to Abby, and to Sarah. Unfortunately, a representative from TREP couldn't be here, but we'll keep them in mind as we go through the service. It's really great to have you here. This is one of the services that I really look forward to, because it gives us an opportunity to share with you. As you all know, we're delighted to be able to share our resources and some of our personnel with you as we go through from year to year. And we just want to know you to know that it's not only your organization that we value, but we value you as individuals. The type of work that you do in our community is just such an important part and so invaluable. And many of you, each one of you, dedicate your lives to the people who, for one reason or another, have had some challenges in their lives. And so it's wonderful to be able to speak with you in person. We think about you every Sunday as we see the things that we have done with you, and we're just delighted to be able to share with you. And we have checks for each one of you, and they will be receiving them at the beginning of this week. So thank you so much for taking time out of your busy schedules to be with us today. If none, we will light the chalice. We light this chalice as a symbol of our commitment to our fellowship and to each other. May our many sparks meet and merge in communion of heart and soul.
Love is the doctrine of this congregation. The quest for truth is our sacrament, and service is our prayer. To dwell together in peace, to seek knowledge in freedom, to share strength in fellowship. Thus do we covenant.
Joy in our coming together this morning. Let there be truth heard in the words we speak and the songs we sing. Let there be help and healing for our disharmony and our despair. Let there be silence for the voice within us and beyond us. Let there be joy in our coming together. Please join me in singing or appreciating our opening hymn, Gather in Spirit.
Sacred hearts to be
you, Kathy. And now at this time, we would like to share with one another any joys or concerns that our hearts. I'll start over. Spirit of community in which we share and find strength and common purpose. We turn our minds and our hearts toward one another, seeking to bring into our circle of concern all who need our love and support, those who are ill, those who are in pain, either in body or in spirit, those who are lonely, those who have been wronged. As you meditate, think about the people in your lives for whom we need to show concern. We are part of a web of life that makes us one with all humanity, one with all the universe. We are grateful for the miracle of consciousness that we share, the consciousness that gives us the power to remember, to love, and to care. So let us take a few minutes and share with one another moments of silence. Thank you. As I said at the outset, we're just delighted to have Sarah, Jennifer, Michael, and Abby with us today. It's wonderful for you, as I said, to take time out of your busy lives and to be able to share with you. At this time, what we'd like to do is to give each one of you an opportunity to share what's happening at your organization, anything that you want to share about what we could do in your community, how you're handling COVID and so on, anything that you would like to share. With deference to personal privilege, I had the opportunity to share. I was on the board of a domestic violence center with Sarah, and I just know what a wonderful she did, and was delighted that she was promoted from her associate position to the director of the Incourage. And I would like to start with you, Sarah, if you mind, just talking about Incourage, the domestic violence center here in Manitowoc.
Well, thank you for inviting me. I appreciate that. So yeah, as Kathy said, Incourage is legally still the domestic violence center, but we serve victims of sexual assault and domestic violence now, and trafficking. So we had to broaden our name a little bit. So we do have a crisis line and shelter that are staffed 24 hours a day and provide a lot of services for those in shelter, but we also provide services for a lot of people who don't stay in shelter with us, including legal advocacy, accompanying victims to medical forensic exams. And so that they go to the emergency room, and then the emergency room calls us. And we either have a volunteer or a staff on call who go accompany victims to those. But we also accompany victims to forensic interviews and interviews with law enforcement and prosecutors, court hearings. We do a lot of safety planning. We've been serving a few victims of trafficking over the last several years, but I don't remember exactly when it started, but there is an anti-trafficking task force in Manitowoc County now. And so we're involved with that. And our two new SAVES Sexual Assault Victim Services staff just attended training on trafficking and on facilitating groups for trafficking victims. So we're excited to have more training and have some more partners in the community who work with trafficking victims. So interestingly, our shelter numbers in 2021 are a little bit lower than 2020, although I hesitate to compare anything to 2020 because I don't think we can compare it. But our other numbers, our non-shelter numbers, have increased for both sexual assault and domestic violence victims. And I think that the reason our numbers for sexual assault victims have increased is because the Lakeshore Regional Child Advocacy Center calls Incourage. And our staff accompany victims from Manitowoc County who are victims of child sexual assault. So our staff go with the parent or guardian while the child is being interviewed by someone who's trained in forensic interviewing. So they only have to go through one interview, and law enforcement and prosecution can use those recordings. So it's a lot more trauma informed and victim friendly than minor victims in particular having to retell what happened multiple times. So in August of 2020, they started calling us directly. And so then we make a connection with that family, and it might just be we see them once or twice, or we might see that family on a regular basis, and we can accompany them or support them throughout all the ups and downs of dealing with the aftermath of being of a child being sexually assaulted, whether that's a criminal process or just the emotional process of going through that. So our non-shelter domestic violence numbers are also increased, which I'm really happy about. I know there's people out there, and our job is to serve them. So I'm glad that when we can do that. Some of the struggles, and I would bet that Michael and Abby might touch on this, is it's really for people who are in shelter. Finding housing is even more challenging than it ever was before. I think, we all know that everyone has trouble finding housing right now. There's just not available units. So it's even more challenging for people who are low income or receiving assistance. And so that's been a really big struggle for our clients who use shelter services. And so I don't know what the answer is. Well, I know what the answer is. We need more affordable housing, but I don't know what the answer is for right now, because that isn't going to happen right away. So that's really a struggle. And I think that, more people will probably have to go stay with friends or family. I don't know, or we'll have longer shelter stays. We'll see. We started having monthly youth nights or youth days back in 2022, and some were online on Facebook, but we've been doing them in person because we provide all of our other services in person and virtual if somebody wants it. And so those youth days are usually themed. So in April, it would be about Sexual Assault Awareness Month. In October, it was about Domestic Violence Awareness Month. They had one Friday night, and I think they just showed a movie. But the idea is to engage youth and make them and their families aware of our services in the community, and not to have it be, a scary or place that people are, a little maybe afraid to go to just because they maybe don't know what to expect. So those will continue, and we post those on Facebook. In 2021, we were talking a little bit about this in the beginning or before it started. Today, we did not have our main fundraiser, Domestic Chef. Usually we have it in the spring, so we didn't feel that was a good idea yet. We did some online events and online auction. We did do a small in-person event in November. That was a murder mystery dinner. It was a lot of fun. And so maybe we'll do that again sometime, we'll see. And we are planning on having, as of right now, our Domestic Chef 2022 event in April. And we know that there'll probably be people who will not be comfortable coming, and that's okay. And there'll be people who are comfortable coming, and that is okay too. And that event is going to be at Par 5 in Mishicot. I think that's pretty much what's been going on by us. So.
Okay. Thank you very much. You mentioned, Abby, and Michael, Abby, would you like to say a little bit about Hope House?
In case
Sure.
nobody
Can
really
everybody hear me?
knows about Hope House, Hope House provides shelter and guidance to assist families in their journey to self-sufficiency. COVID has shown us that homelessness is quite the issue in our community right now. I know that since the eviction moratorium has been lifted, that we have been seeing a big increase in our waiting list numbers. Currently in our waiting list numbers, we have 8 families that are in need of shelter in Manitowoc County, along with 27 single females, as well as out of county, we have 13 families and 14 single females that are in need of shelter here. Due to COVID, we have decided that the best way to keep all of our staff and volunteers and guests safe is to cut down to our half capacity. So Hope House has 7 rooms, and we have decided to go down to 4 rooms being filled. This also helps with social distancing. And we are now requiring masks for when everybody enters the building. We did have one COVID outbreak this year in October. So that was the first time that happened, but it taught us a lot of how to try to not have that happen again. So we were fortunate enough that the Holiday Inn allows quarantining for our families while we were able to disinfect the entire building at Hope House. And a little bit of statistics for 2021, we total, as of now, have served 92 people. 40 of them are adults and 52 of them are children. So this year we've served a total of 37 households. And I know Sarah had mentioned longer stays. For our program, we're a 90-day program. Right now, we have had to increase our stays. Many of our people are there longer than 90 days. It's too hard to find affordable housing. We have quite a few people that are eligible to receive rental assistance, and they can't utilize that rental assistance because the apartments that they find are way over fair market rent values, which is hard because most people that come to Hope House have some sort of a barrier, whether it's a prior eviction. Even we've had people that have slept in their car that get denied housing because it's a gap in rental history. So the rental market right now is extremely competitive. So anybody with one of those barriers is going to have to fight extra harder to make sure that they can get into affordable housing. So right now, our case managers are really working hard to work with our families on their goals. Everybody has different goals when they come into Hope House and receive case management services. Some people come in without any food share, health insurance. Right now, childcare is a big issue. All of our families currently are single mothers that are having a hard time working because even though they can receive childcare assistance, there's no childcare certified childcare providers available. Everybody has a waiting list. So that goes back to our 90 days. A lot of people are having a hard time getting employment to get the income to move out within the 90-day period. I'm trying to think if there's anything else. I know we haven't had a major fundraiser this year either. COVID has anything group related we have just kind of shied against this year. We've even eliminated our volunteer overnights. All of our overnights used to be covered by volunteers, and since the pandemic has started, we have eliminated utilizing volunteers for those overnights. Instead, we've hired 3 paid staff members that have been really great on our team to help cover those shifts. They're very reliable staff members that cover a lot of those crazy hours because we've just lost so many volunteers due to COVID. I think that's about it. I'm just trying to go through some of my notes here, but I guess I feel like with the pandemic, we've just seen a big increase in our numbers this year. And I know too, it's with getting families in and out within 90 days has been extremely difficult. And there's just a few barriers that we're seeing now, again, after that eviction moratorium, and just some of the lack of childcare is what our biggest issues are currently, which is hard to get our families into their own housing.
Thank you, Abby.
Yeah.
Jennifer, would you like to speak for Painting Pathways?
Let's see where to start. I guess I do want to piggyback on to what the others have said in terms of housing. I would say that is probably our biggest crisis right now in our community, and we see it too, affordable housing. Again, you know, the barriers that our members face, many of them do have prior evictions, or due to the nature of their mental illness, if they end up in the hospital and aren't able to, you know, follow through consistently with paying rent, or if they have a prior conviction on their record, that is also a barrier. And unfortunately, many of our members do have been involved in the legal system. So any ideas or collaborations or community movement that we can work towards with affordable housing is crucial, I think, at this time. I would say we just celebrated last month 1 year in our new building, and it is fantastic. We have settled in and really started to get a feel for a rhythm and our daily activities. We still have not gotten to pre-pandemic levels in terms of daily attendance. Probably we were at, I want to say maybe 30 to 35 average daily attendance before the pandemic. And we are now around 22 would be our average daily attendance. So we're getting there. Still some struggles in convincing members to come out. This pandemic has been going on so long, and for folks who tend to isolate anyways, they've just kind of, some of them dug in their heels, and the anxiety of getting back out in the community, the misleading and conflicting information about the pandemic, and a lot of factors. But we continue to do really aggressive outreach with our members. We during the pandemic started delivering food and hygiene supplies to our members who requested it. Initially, that was twice a week. Once we opened back up, it reduced to once a week, but we continue to do that. We average probably about 14 or 15 deliveries a week to our members who aren't coming in, but that's just a service that's unbelievable. It's helpful. It gives us an opportunity to check in on folks too and see how they're doing, see how their mental health is. The pantry, of course, our food pantry is open to members who are coming in. They can get food from us anytime. I think we're on pace this year, same as last year, about 10,000 pounds or so of food that we've given away. So it definitely fulfills a need for our members who might be reluctant or have some anxiety going to other food pantries in the community. The holidays tend to be a difficult time, so we're just, taking cues from our members and keeping things low key. We've done a few fun activities in terms of cookie baking. That's kind of become an annual thing, cookie baking with the grandmas. And we decorated some ornaments, ceramic ornaments. Someone donated kits from Glaze and Paint, so that was a lot of fun for our members. We will be open on Christmas Eve from 10 to 2. And then staff and volunteers will be preparing a ham dinner, and we'll be delivering those out on Christmas Eve to any of our members who request it. And we plan to have a Zoom on Christmas Day for any members who just kind of want to connect in and see how, check in and see how everyone's doing. Probably this year, I would say we've done a lot more case management type activities or services for our members, connecting people to various benefits, the housing, food pantries beyond ours, just a lot more crisis-oriented types of things. On a positive note, also, we continue our collaborations with other nonprofits in the community, which is a blessing. It's helpful to all of us as nonprofits, but it's helpful to all the people that we serve. We've been opening our space, our conference room space for other nonprofits to use, and we're working on expanding that. We've had NAMI join us as they're housed in our facility now, so their services will all operate out of Painting Pathways. We work closely with the Salvation Army too, whenever we can, volunteering members and staff, and that's been a really wonderful collaboration, mutual collaboration. Big news for 2022, we are planning to hold an art show that will feature, and some of you may be aware of this already, Benita may or may not have shared, but Benita Budich from your congregation is kind of helping us lead the way with some other folks to do an art show that will coincide with Mental Health Awareness Month in May. It's continuing to evolve. Initially, we wanted to have an in-person event. I think we're leaning more towards an online auction now, but it will feature member artwork as well as professional artists and some legacy artwork. So stay tuned for that. It's exciting. And we had planned one in 2020, and of course, with the pandemic, had to cancel that. So we've also been very limited, like the other nonprofits have said, in having in-person events. We canceled our in-person fall fundraiser, so that would be the next big thing is our May event. Also, for those who don't know, I have made the decision to leave, and so we're in the process of searching for a new executive director. It's time. We've gotten to such a great level at the clubhouse, and it's time to turn over the reins to the next person to bring it to its next highest level. So I'm very excited about that. I, at this point, don't have specific plans. I want to take some time off and then decide where I'm going to put my energy next. It's most likely going to continue to be with mental health. I think this pandemic, more than anything, has raised the importance and attention to mental health and what we need to focus on. So I think there will be plenty of opportunities coming up. So that's what's in the future. And also there's the hope to be hiring a program director next year for the clubhouse too, which will allow us to finally expand some services. We really, really need to have some young adult programming and focusing on the 18 to 25-year-old age range in a more intentional way. So look for those things in 2022. And thank you again for having us today.
Thank you, Jennifer.
Mm-hmm.
Michael.
Good. Okay. And I'm sure most of you know that the Haven and Manitowoc County, we serve men only. We've been in existence for over 7 years. And so what has taken place since the pandemic, of course, we did not know what the future looked like when the pandemic hit. We actually in 2020 ended up closing for about 2 or 3 weeks. We were able to house the men that we did have in shelter. We had 10 men in shelter. We were able to house all 10 successfully. And we were closed for 3 weeks just to wrap our minds around how are we going to continue services. As you know, there were about 10 to 15% of the shelters in northeastern Wisconsin that ended up closing their doors because of this world health crisis. So, but so far we've pivoted well, and our capacity is 20 men. Before the pandemic, we were averaging 15 to 17 men in shelter. Our capacity is now down to 12 men at a time. We average about 8 to 10 in shelter right now. All the men that come in our shelter in order to be a part of the program, They do have to have a COVID test with a negative result before they can enter shelter. And they're also asked to wear masks as well. So we do a really good job at social distancing, making sure we're constantly cleaning and sanitizing the shelter. So far this year, we've served 73 men, and we've housed 68% of those men. I don't know how we've done that with, as all my colleagues stated, with the hard time of finding a good affordable housing. And it's just not affordable housing, but good affordable housing. Some of the housing units that we did find was like really low quality, didn't have, smoke detectors, or, I would rather have our guests stay in shelter longer to find something of quality. I think that's what's really going on is there's affordable housing there, but what's being offered in my experience with our guests are kind of holes in the wall, so to speak. So we won't accept that. All of our men currently right now in shelter, we have 8 men in shelter right now. All of them are employed. And one thing about employment that I've looked at with our guests in shelter is that all the men do a very good job at finding work. And I love the fact that our temporary employment agencies help our men hit the ground running so they can save money. And because of that, we're able to house men in the average of 46 days versus our average in 2021 was about 68 days. But what I looked at is, yes, men were working at the temp agencies. They were saving money to self-resolve. However, when it came to a toothache or some type of ailment or a sickness, they didn't get the insurance because the state insurance that they have runs out as soon as they start working. It's cut because they are making money above that poverty level of $11,460 a year. So I had to take a look to see, okay, is it more important that they're getting good health insurance versus making a lot of money, saving, and moving into their own apartments? Of course, that's what we want. That's our bread and butter. However, we needed to look at a way to help men get insurance. So I took it upon myself to go to other manufacturers around the city and the county and create and partner with MOUs to say, hey, I know you work with a tip agency, but if you can directly hire our men in, it's all about insurance. So instead of waiting, 60 to 90 days for an assignment to quit and not knowing when you're going to get another one, being directly hired, that 60-day probationary period, they're just waiting to get insurance, 401k, be a part of the union. So with the partnerships of MTM, SCANA, Ammo Inc., EC Industries, and a couple of other manufacturers, we were able to get men hired directly into those establishments. So not only are they earning a productive income, now they have insurance and they can go to the doctor. So that's very important. Programming wise, we took on the TBRA program, which stands for Tenant-Based Rental Assistance. We've only, because of the competitive nature of affordable housing, we've only gotten 3 of our guests out of 15 that qualify. And our TBRA, our Tenant-Based Rental Assistance Program, which is what TBRA stands for, we can pay up to 3 months rent. Men can come in if they qualify for that program. They don't have to have money saved or a job. They can move right into the apartment. We can pay up to 3 months rent and case manage them in the home, which has proven to be way less expensive than having them in a shelter program. So we really like that program. But if, affordable housing, I don't know, what the magic source is going to be to open that up, but we can house a lot of men, right away versus having them come to shelter, which is what we would like. So the future of the Haven, and before I get into the future, I'll let you know about some of our fundraisers. I don't know if you've heard of our fundraiser, Shamrocks for Shelter. It's one of our big premier fundraisers during St. Patrick's Day weekend. We had to cancel that in 2020, and because of the Delta variant, Omicron, and we're really glued to the news with all this stuff. We want to open up Shamrocks for Shelter March 12th, 2022, but we're going to make a decision when we have our committee meeting in January to see if this is something we should move forward with. We're being real skeptical about doing that and having a big event. I know one of our board members went to an event to the venue where we're going to have the Shamrocks for Shelter for a Halloween party, and 8 people contracted COVID from that party. So that was a real eye opener. So we're going to look at that carefully, and we might have to make another decision about that. Our Cardboard City, in collaboration with Habitat for Humanity and Hope House, was a great success. We raised over $19,000 collaboratively and split that between the 3 of us. So that was a really way to bounce back. In 2020, we had to do it virtually, and it was a success as well. Our Sunday Fun Day at the Wharf, in partnership with Brennan C. Hafer, was a success as well. And in the future, another fundraiser, and it hasn't been planned yet, but we are looking at a Haven holiday sneaker adult prom to take place in the fall sometime. And I think that's going to be really fun for the community to come join us for that. In terms of the future of the Haven, we do want to move into more transitional housing. As the affordable housing market is not viable for our guests, and it's really hard to get into that. Just having some transitional housing for those men who really worked hard to go into a transition housing unit for 6 months to a year, to even help with, and many of my colleagues stated about evictions as well, to pay evictions off, to get their credit together, and really look at a budget plan to truly self-resolve. We really don't care how long men stay in shelter, but what I do care the most about is men that return. We don't want men returning to homelessness. So this is something in our future. We're looking at the rectory on our campus, and we are working with an investor that reached out to probably purchase help us purchase the property, so we can really start doing some good things from an infrastructure standpoint, and also expand our services as well. So that's about all I have.
Well, thank you, Michael, and thank you to all of you. Are there any questions that we have that you would like to ask? We have a few minutes for a couple of questions. Sandy.
Yes, everyone has mentioned affordable housing. Who is responsible for providing that to a community? Is it the city, the county, the state, or is it totally reliant on individuals? And
I would say we have programs in place, but we are reliant on those landlords to partner with us to provide the units. And so it's really up to the landlord. We do provide a landlord training to talk about those programs. We're going to try to do that annually. And Sarah, correct me if I'm wrong, But with this training, we hope to open minds and to secure more units. And I believe from the balance of state, which is a continua that oversees 69 counties dealing with homelessness, our facilitator for the Lakeshore area, which is our area here in Manitowoc County, we would need an additional 60 units to get ahead of homelessness and kind of put a stop to it. Not saying people will not be homeless, but to house people at a rate where they wouldn't return to homelessness. Sarah, did you have anything to add with that?
So when you were asking the question, Sandy, what I was going to say was yes. So our city governments could have a role in bringing in more affordable housing to our communities. So if that's something that's passionate for you, help us.
Cheryl.
Piggybacking on that, you mentioned how there's units out there, but they're not habitable. And sometimes I see that with some of my patients, where they're living, and we find out through the adult protection services that they've gone in, and sometimes it's self-induced, and their psychiatric condition that's contributing to that, such as hoarding, etc. But is there, besides just finding units, who is responsible for overseeing that the landlords are keeping the homes up to code?
I believe each city has an inspector. I don't know their exact.
Yeah.
Do you know, Michael?
Yeah, no. Each city has an inspector, and that inspector comes in to inspect the unit before our guests or participants move in. And you do have some landlords that will not accept an inspector coming in, which means they have to do a lot of improvements. There's money out of their pocket. And that's something we've run into over the years.
Is that legal, that they can actually rent out a unit that is not considered safe?
It shouldn't be, but if out of desperation, if someone needs a unit, landlords like, if you don't say nothing, I will. You have a roof, I'll try to do the best I can. I've heard that before too.
Sure.
So,
and that's often why people can report those landlords to those city officials, but they don't want to because
Yes.
they're afraid of losing their housing.
Yeah. Just a separate question, if you don't mind, and as a resource, I'm running into a situation recently, and it looks like the Boy Scouts are doing a civil action against the organization versus the assailants because of the time from years back. And I have a person that has been contacted to write a report, and unfortunately that's brought out some psychological PTSD, he's having nightmares again. And I was wondering if any of your organizations are actually a resource for counseling. He is not working. I guess he's on Medicare. I mean, I've sent him out to Holy Family Behavioral Health, but I didn't really know if there was more of a dedicated service. He's also, he was worried about the perception. So he's from out of state, and he was worried about the perception of the community here. And that's why he didn't reach out to anybody, thinking he would not be accepted, as he's also gay.
Jennifer, do you?
I was just going to say, we don't provide counseling or therapy, but we are, an adjunct service. So the people we serve, we refer to as members. Our members typically get, psychiatric care and counseling outside, but the clubhouse provides certainly peer support, emotional support, structure to the day. We're open Monday through Friday. It is a place to go. It is a place to contribute whatever skills an individual has, to be accepted. It's a very non-judgmental environment. Members, have dealt with stigma their entire lives for many situations, not just their mental health. So it is a very accepting environment, and a place where, like I said, someone can go and feel accepted and contribute their skills and connect with other resources that maybe they need to continue forward with their goals.
Thank you.
And the other presumption, I'm presuming that everyone or these organizations all have access through public transport, like the bus drops off close by to the locations.
Yes.
Thank you.
The bus company actually moved their bus stop when we moved to the new shelter. So it's at the end of our driveway. We don't offer counseling or therapy either, but for survivors in that kind of situation, perhaps a support group would be something that you would be interested in. We don't have any running right now, but we will probably start some in January, and we've been doing like 4 to 8 week groups dealing with trauma and empowerment and those sorts of things.
Do your organizations work directly with the medical organizations? I'm with Holy Family, Aurora, in terms of their behavioral health department.
Yes, we work directly with Lakeshore Community Healthcare, which has been huge for our guests that really need behavioral health counseling. So that's worked really well. But I have also worked with Aurora as well. It's just such a long waiting list with some of the medical institutions as well. But Lakeshore Community Health seems that we can, get men in sooner versus the other two.
I'm not familiar with that. Who's that through? Is that an independent?
Yeah, Lakeshore Community Healthcare. They have a medical institution in Sheboygan and in Manitowoc. So it's actually a nonprofit, and it's geared towards more of the indigent in our community that really need medical and behavioral health services. So,
Okay.
it's a pretty neat institution, and man, they've really helped a lot of our guests.
Okay. And I think that's different from Lakeland Community Care. I think they do primarily Medicare type population.
Yeah.
Okay, thank you. Yeah.
Lakeshore Community Healthcare is they're a federally qualified, don't remember the exact, federally qualified healthcare provider. And It started as a dental clinic years back when there was no dental care for people, kids and adults who got state and health insurance. So they're a great resource. And we refer people for therapy and counseling to everybody because waiting lists are so long. And a lot of many of our clients they either have state insurance or are not insured.
Yeah.
One last question anybody has? As I was looking over our 4 groups, Painting Pathways, Incourage, and Abbey Hope House have all had new facilities since we've been associated with you, and that's just great. Michael will keep helping you. Okay, thank you all very much. We really appreciate having each one of you here, and we look forward to being able to sharing to the best of our ability with you, not only with our resources, our financial resources, but also as volunteers.
Thank you. Thank you for having me.
Okay, please join me in singing our closing hymn or reviewing our closing hymn, Our World is One World.
That wash
Thank you, Kathy. Please listen to our closing words. No matter how weak or how frightened we may feel, we each have gifts that can make a difference in the world. In this coming week, may you do at least one thing: to support the broken, to welcome the stranger, to celebrate what is worthy, to do the work of justice and love. Be strong, be connected. Each day, act so you may be a little more whole. Again, thank you to the four of you for being with us. It's been a real joy to share with you. I hope everybody has a wonderful week, and we will see you next week, the day after Christmas. Please join us for our holiday celebration.
Thank you.